Dr. Joe Congeni at Akron Children's Hospital, joining us live in studio. Joe, I saw this thing before we get to your stuff this morning, and I know you've talked about this because often when we talk about concussions, it seems like we go back to football, which is the easiest thing. But I saw a stat the last couple of days that said cheerleading concussions almost as much as organized football.
Yeah, some of the cheerleading concussions are more severe too. They last longer.
Interesting.
I think they're higher impact sometimes with some of the jumps and throws and mounts and things like that. I think it's a relatively higher risk sport. I know people do not believe that or think that. We definitely see that play out at our office.
Do you and real quick, like, because we always say football with concussions, but you see them in soccer too, don't you?
Oh, my gosh. Soccer and basketball are the two fastest growing sports. So no question about it. Girls soccer and girls basketball, two fastest growing sports. When we add new sports like lacrosse and stuff, lacrosse is in the top 5. So there are a lot of other offenders at an office like ours. Us trying to figure this out, it's not just a football thing. That is another myth of this, is that it's just football. Not at all.
As we wind down the fall season, I know there's a lot of district semifinals, playoff soccer tonight, and we're also seeing playoff volleyball. And you've been covering volleyball the last couple
I
weeks.
went last night, and I wanted to just very briefly shine a light on this group of very hardworking athletes. We don't talk about them much at all. The volleyball players. For people who don't know, girls volleyball, wow, these girls are so much more athletic. And so I was at a district, 2 big games last night that I saw, and so athletic. They work like so many of our other sports almost year-round. A lot of the better players, 6 months, 9 months. The way they work through a group called Junior Olympic. And so at the end of their high school seasons, they jump into Junior Olympic training, and they will play for half a year or more. So we do get into the overuse injuries. So the 3 major injuries, the 2 overuse injuries that we see all the time is jumper's knee. They get a lot of patellar tendonitis around the knee, so they ache and hurt a lot. And with training, we try to work with the coaches. Hey, there's certain things that really can put your girls and kids at risk for jumper's knee. The other one is stress fractures of the low back. Our number 1 most common stress fracture, called spondylolysis, is very common in volleyball. Top 5 sport is volleyball, with all the serving and net play and arching that they do, arching over and over again. And the third is they get on the traumatic side a lot of ankle sprains, a lot of jumping, landing on somebody's foot, landing on the side of the court, landing funny, a lot of ankle sprains. So it's always, whether it's in vogue or not, whether they wear braces. Everybody has a brace on, or now we're in a period of time where last night it caught my eye. Almost nobody has the preventative braces anymore. They're hopefully working on strengthening programs in the off season to prevent those things. But volleyball is a sport, really high level, high action, fun to watch. Kids who work really hard, and they don't get a lot of the attention, but they're obviously not in it for the attention. They learn a lot of great lessons from that sport.
A lot of leg strength here. I'm watching some of those matches, girls, and then in the spring with the guys, a lot of leg strength
for
there.
Sure. So I also wanted to
You mentioned patella. Go ahead.
I did. I want to mention that is the feature player in the NFL, the MVP. And so, he was on his way again this year. And a couple instructive things about the Patrick Mahomes thing, the Mahomes injury and the knee injury, is he really was battling that ankle for a couple of weeks before that. And one of the things we see in sports medicine, it's a hard thing to study and stuff, but kids will be battling one injury and trying to come back and rehabilitate one injury, and then they seem vulnerable, a lot more vulnerable to getting a second injury. I see that in high school kids in the office a lot, I was really battling, trying to rehab one injury and came back. So he ankle, and then he gets a patellar dislocation. That is right up our alley. So one of the real common plant and twist injuries that's not ACL, it seems like we hear so much about ACL, particularly in younger athletes, but it can occur even in 20s and 30s, is the kneecap pops out of the groove. The groove is really shallow for the kneecap. So it happens fairly frequently. Sometimes it just slips part way and back in. But when they tear the ligaments that hold the kneecap in the groove, it swells a lot. It pops all the way out. We have to go back out there on the field sometimes and move it back, pop it back into place. And the ligaments take about 4 to 6 weeks to heal. Now, right away in a guy like Mahomes, they were talking, hey, surgery maybe and all this kind of stuff. Not in our high school kids and things. We can get these better if they rest and rehab.
Really?
But the deal is that many kids don't know exactly what it is, don't know what to do. So in 7 to 10 days when they're feeling a little bit better, they rush right back to play. You know, we have smaller numbers. We got to get back out there and play. If those ligaments hadn't gotten a chance to heal, or they haven't strengthened, or they're not wearing an appropriate brace, the re-injury rate is exceedingly high. If they do all the right things, especially rehabilitation, some time to allow some healing of those soft tissue fibers that hold the kneecap in the groove, the ligaments that hold the kneecap in the groove, they do well. And there's some people that are really prone to it. So if you have a very shallow groove or a high riding kneecap, and it seems like our female athletes, because of the angle from the hips to the knees, are pretty prone to it too. There's some things that predispose you to it. But I do see this phenomenon of having one injury and then springing a leak somewhere else.
One quick question on the dislocation of the kneecap.
Yeah.
Once you have it once, are you open for that happening?
Your risk goes up a lot. And so overall, probably from when I got in the field 30 years ago, 50%, 60% recurrence risk, because people didn't know how to rehab, how to give it time to heal. Bracing maybe not as good. Nowadays, 25, 30%. If people do things right, they go about their career and do very, very well. If people get a second and a third and a fourth, then they get so loose that there's no problem, no doubt about it. Now they do need surgery.
All right. Good stuff. Thanks for coming in.
All right. Thanks, Ray.
Dr. Joe Congeni, Akron Children's Hospital. He joins us Wednesdays at this time.